اعوذ باللہ من الشیطان الرجیم بسم اللہ الرحمن الرحیم کیف تکفرون کیف تکفرون باللہ وکنتم امواتا فاحیاکم ثم یمیتکم ثم یحییکم ثم الیہ ترجعون هو الذی خلق لکم ما فی الارض جميعا ثم استوى إلى السماء فسواهن سبع سماوات وهو بكل شيء عليم. اللہ کے نام سے، بسم اللہ، اللہ کے نام سے، اسم نام کو کہتے ہیں. بسم اللہ، اللہ کے نام سے جو بہت زیادہ مہربان، الرحمن الرحیم، بہت رحم کرنے والا ہے. کیف تکفرون، کیسے تم انکار کر سکتے ہو. کیفا کیفیت، کیسا، کیسے ہم پوچھتے ہیں نا کیسا حال ہے، تو وہ کیف تکفرون، کیسے تم انکار کر سکتے ہو باللہ، اللہ کا. وکنتم امواتا، اور تھے تم موت کی حالت میں. فاحیاکم، تو اس نے تمہیں حیات دی، حیات زندگی دی. ثم، پھر، یمیتکم، وہ تمہیں موت دے گا. میت سے ہے. ثم یحییکم، وہ پھر تمہیں حیات دے گا، زندہ کرے گا. ثم الیہ ترجعون، پھر اس کی طرف تم لوٹو گے. رجوع، رجع، رجوع کرنا. هو الذی خلق لکم ما فی الارض جميعا، وہی ہے جس نے خلق، تخلیق کیا، خالق ہے تمہارا، تخلیق کیا تمہارے لیے. ما فی الارض جميعا، جو زمین ارض میں ہے، جميعا ان ٹوٹو، سب کا سب. ما، جیسے ہم کہتے ہیں ماشاء اللہ، جو چاہے اللہ، تو جو بھی زمین میں ہے، جميعا جمع سے سب کا سب. ثم استوى الى السماء، پھر وہ آراستہ ہوا. الى السماء، یا متوجہ ہوا، یا اس نے قصد کیا، ارادہ کیا آسمان کا. فسواہن، تو مساوی، برابر بنائے. سبع سماوات، 7 آسمان. سماوات، سما کی جمع. وَهُوَ بِكُلِّ شَيْءٍ عَلِيمٌ، اور وہ کل شے کا خوب علم رکھنے والا ہے. کل ان ٹوٹو، ہر چیز کا خوب علم رکھنے والا ہے. How can you disbelieve Allah when you were lifeless and He brought you to life? Then He will bring you, or He will cause you to die. Then He will bring you back to life, and then to Him you will be returned. It is He who created whatever is on earth in toto. Then He directed Himself towards the heaven, and created 7 heavens, and he is knowing of all the things. Subhanakallahumma wa bihamdik. Ashhadu an la ilaha illa anta astaghfiruka wa atubu ilayk. अच्छा जी. I welcome all of you to this online introduction to the training programs which we are going to start online at Abdullah Diagnostic Ultrasound Clinic, Lahore, which is affiliated to the Torah Numon Institute, Lahore. If you have any queries, you can always contact us on this WhatsApp, and at the end of the session, we'll give you some more contacts. And this is our email address. You can take a picture of it from your mobile and you can WhatsApp for any of your queries. We are going to start, which actually we have already started, 2 training programs online after this the Corona era, and we are very grateful to Allah Almighty that Alhamdulillah, those training programs which we started after this Corona outbreak, they have proved to be very successful. And that is why I thought that we should have an introduction to all the training programs which we are going to start online from Abdullah Diagnostic Ultrasound. So the first one is online level 2 basic ultrasound training, in which we will train our participants and they will come to know how to perform a complete abdominal, obstetrical, gynecological, and soft parts ultrasound. Any of these training programs conducted for you will have different sessions, including the biophysics of that particular program, the nobology, how to make the best use of your machine, the subject which will be covered, the syllabus which will be covered with the help of slides, which I'm going to show you today, with the help of videos, which we will be showing you today. And then we perform the examination on our patients, showing the detail of hands-on session, the detail of probe movement and how we are going to move the probe, and at the same time, what are the novologies, what are the parameters, machine parameters to play with in order to have the best possible image, which is easy to interpret and to understand. And if there are any shortcomings, how to get rid of those shortcomings and discussing them with you in detail. These patients we will be showing you are selected one with normal and abnormal findings. So, real time examinations of these patients while I am moving the probe on their abdomen and the real time adjustments of the machine knobs on the keyboard and the real time audio explanation audio explanations about the images which we are seeing on the monitor. So when I will be explaining you all those images, it will become easy for us to understand and interpret the image. As I mentioned, that these patients will be carefully selected for you so that we can cover all the basic and advanced details of different images. And if I am performing an interventional procedure, then again, all the steps which I will be taking to perform the procedure will be explained to you. We believe that inshallah, as we have seen in two of our training programs which we have started online, the basic level 2 ultrasound training and the advanced ultrasound training. These we have already started, and soon, inshallah, we will be starting the other 4 training programs. The second training which we will be starting online is level 3 advanced ultrasound training for those doctors who are interested in learning advanced techniques in conventional and interventional ultrasound. The third training program, which is available online now, is the ultrasound training for master trainers of paramedics in collaboration with Fatima Jinnah Medical University, Lahore. This is a one-year program, 2 days a month, or a 6 months program, 4 days a month. These training programs for master trainers, it covers both obstetrics and gynecology. And with the collaboration of Fatima Jinnah Medical University, a very prestigious university with maximum number of obstetrical services being conducted there, we believe that this training will prove very beneficial to all of our participants, especially those doctors who are involved in training paramedics and their house officers. This is an advanced training program, and we believe that those who are really keen in learning the role of ultrasound in feto-maternal medicine, in diagnosing congenital anomalies, in doing interventional procedures in obstetrics, this program will be very useful. A new training, which is online transvaginal ultrasound training with online hands-on demonstrations on the patients. It covers the probe handling techniques in transvaginal ultrasound in a way that without our trainees visiting us here at our center, the training is explained in such a way that they themselves can learn all the techniques, and all their images or their videos, which they will send to us, they will be given suggestions to improve their technique, etc., online. This also we have started, and we have already done one session, and the second will be on the 5th of November. So if you are keen, you can join that 5th of November session. That will be an introductory session for you and free of charge. You can contact Mr. Munir Ahmed for that purpose. These trainings, which we have started with the help of this Zoom software and app, we can demonstrate to unlimited number, but when we will start online hands-on training programs that will be limited to not more than 25 participants in each group. The trainings are very meticulously divided into lectures and syllabi. So if by any chance you miss a lecture number, you must remember that number, which will be repeated quite frequently, and anything missed will be then taken care of. All these training programs are either for a session of 2 to 3 hours or they are full day, according to the convenience of our participants. So because many of our trainees are very busy practitioners and it is not easy for them to leave their premises, therefore, we will offer them 2 to 3 hour sessions once or twice a week, or once a month, 1 day session or 2 days session, depending upon their availability. We are also going to start online whole body color Doppler training with hands-on sessions on carotid and vertebral artery, mentioning all the details of the probe handling technique. In obstetrical Doppler, we cover umbilical, uterine, middle cerebral artery, and ductus venosus. The portal venous flow and its Doppler, the renal artery flow and its Doppler, lower limbs, veins, and arteries. So this whole body color Doppler training will be available soon. Any of our trainees interested in this can contact Mr. Munir Ahmad. And the last training program, which is available to very keen and ambitious sonologists who would like to enter this wonderful world of interventional ultrasound, different interventional procedures which we perform as like the intrauterine procedures, ultrasound guided biopsies, putting catheters inside the body, etc., will be demonstrated in detail. So, with this basic introduction, we would like to give you a demonstration of our online level 2 basic ultrasound training program. We will give you a few examples, like in this we will consider today that if we have to see the uterus, how are we going to put the probe